The Mental Status Examination Boot Camp has been divided into 4 parts, and Part 1 will cover the following topics. Overall, the mental status exam is analogous to the physical exam in a medicine, history, and physical note. It is a place to describe objective evidence of the patient during the psychiatric interview, including the patient's appearance, cognition, and thought process. This documentation is important because it can help with justification of a patient's diagnosis. Examples will be provided throughout this boot camp.
One of the first things you may document in your mental status examination is the patient's appearance. This simply means how the patient looks. Consider what the patient is wearing and if it is appropriate for the specific setting. Observe the patient's overall grooming and hygiene. Is the patient appropriately groomed? Is the patient malodorous or disheveled in appearance? Appearance can help clue you in to a patient's experiences. For example, poor grooming and hygiene may represent a poor level of functioning or difficulty with activities of daily living in patients with psychotic or substance use disorders. This can also indicate self-neglect in a patient with severe depression. Scars on a patient's wrists may indicate a history of self-harming behaviors.
When documenting behavior, there are several things to consider. How cooperative is the patient with the interview? How is the patient acting overall? You might also comment on their eye contact with the interviewer. These are some examples of how you might document a patient's behavior during the psychiatric interview. If a patient is actively talking to or addressing someone who is clearly not present in the room, you might document that the patient is responding to internal stimuli. If the patient is experiencing active paranoia, you might document that the patient is scanning the room often. The motor behavior can be defined as a description of the patient's movements. Are they exhibiting any abnormal or increased movements? What types of movements are they exhibiting? Motor behavior observations may clue you into a patient's agitation or underlying extrapyramidal symptoms or neurological issues. For example, a patient who is constantly moving, pacing, or appears restless may be exhibiting psychosis or mania, or may even be under the influence of a substance. A patient with a rigid tremor of the arms may be exhibiting extrapyramidal symptoms from antipsychotic therapy. The Abnormal Involuntary Movement Scale, also known as AIMS, can be used to monitor patients taking antipsychotics for antipsychotic-induced abnormal movements. However, although AIMS is a quantitative measurement of abnormal movement, the scale used to quantify the movement is subjective.
The speech section of the mental status exam is where you can describe the patient's verbal communication. Some things you can use to describe a patient's speech include the volume, tone, amount, rate, rhythm, and fluency of the speech. Documentation of speech can be helpful in certain situations described here. For example, patients who are acutely agitated or patients currently experiencing a manic episode may exhibit loud speech at an increased rate. A patient who is slurring their words often may indicate substance intoxication. Here are some examples of terminology that you may see used to describe speech. Some of this terminology is not the same as a speech pathologist might use, but regardless of which terminology you use, the main thing is for you to be able to convey how the patient is speaking so that another provider reading your documentation can understand.
It's important to understand the difference between mood and affect. Mood is how the patient describes their own emotional expression. You should document this in quotations exactly the way that the patient describes their mood. Affect is the patient's emotional expression observed by others. In this section of the mental status exam, you can describe the emotional expression in terms of the quality, quantity, appropriateness, and range. You can also document whether the patient's affect is congruent with the stated mood. That is, if the patient describes their mood as sad, does the patient seem sad? Regarding range of a patient's emotional expression, there are several common descriptors that are used. A restricted or blunted affect means that a patient has a significant reduction of emotional expression. Patients with certain conditions, such as severe depression, may have reduced emotional range. This should be documented as a restricted or blunted affect. On the other hand, a flat affect means that a patient has no emotional range at all and is a manifestation of a negative symptom of schizophrenia. The patient's emotional expression and description of their mood can help guide your management of a patient. For example, if a patient describes their mood as fine, but they just came into the hospital with suicidal ideation with a plan and intent, this can clue you into a potential safety risk. The patient likely requires admission for their own safety.